Bridget Lake, president of the Oviedo Winter Springs Regional Chamber of Commerce. We are here today welcoming you to our Florida Executive Order discussion with Seminole County. Our quick chamber announcements is we do have our resource tab on oviedowintersprings.org, our COVID-19 tab. We also have our Facebook page and our upcoming events that are listed on the screen right now. We have our Virtual Business Alliance coming up Monday, April 20th, Tuesday, April 21st. We have our Economic Development Committee, and Wednesday, April 22nd, our Zoom Cafe. Thursday, April 23rd, our Real Estate Connection. Today's event sponsor is Compassionate Cremations, Banfield Funeral Home and Crematory, serving Central Florida since 1989. Family owned by Greg Banfield and his son Corey, they established Compassionate Cremations 7 years ago and will be opening its newest location in Oviedo this summer. And now I would like to introduce Alan Harris. He's worked in emergency services for over 24 years. He began his career while completing his degree from the University of Florida in Gainesville. He has managed a plethora of events, including hurricanes from Charlie, Francis, Janine, and tropical storms, including Tropical Storm Faye in 2008, the worst flood in record history in Central Florida, to civil unrests, including the Zimmerman trial and the Pulse Night shooting, including many more recent hurricanes in recent years. Alan is the co-chair on the Regional Domestic Security Task Force and involved in many homeland security groups. In 2012, Alan was selected as Intelligence Liaison for the Year for the Disruption 3 domestic security events. In 2013, Alan was recognized as the Emergency Manager of the Year for the state of Florida. He teaches numerous federal emergency management agency and Department of Homeland Security courses. Alan has achieved the Professional Emergency Manager certification by the Florida Emergency Preparedness Association and was awarded the Certified Emergency Manager designation by the International Association of Emergency Managers. Now, Alan, I've said emergency managers like 10 times. This is a lot. This is a lot that you've covered. I want to thank you for what you're doing. I know that you're on weekly, bi-weekly meetings, updating us with Seminole County updates. You've done an amazing job. We've been watching them. We've been sharing them. They're actually on the Seminole County Facebook page. They are vital for our community to stay up to date. Can you give us a brief recap if you missed the update today, what has happened?
Sure. So thank you very much for having me. The one disaster, people ask me a lot, how many of disasters have you dealt with? And I've dealt with quite a few. The one disaster I never wanted to deal with in my entire career, and I was hoping I would get through my entire career, and that was a pandemic. And of course, here we are responding to the COVID-19 pandemic. We have currently in our county, and this is as of just a few moments ago, we have 313 people that have tested positive for COVID-19 in the county since the beginning. There is a good number in this, and that is currently 218 individuals have completed their isolation and quarantine. They are no longer have a fever. They no longer have a cough and challenges with respiratory distress. So there are some good numbers, but we continue to get positive cases each and every day. Most of those cases are now community transmission. So we understand that it is out in the community. It's not travel related anymore. It is inside our community. And unfortunately, people are contracting it by just community connection, so community involvement. Why have we seen a decrease, or why we have seen a decrease in the number of positive cases is, I believe, because of the social distancing. And most people have said that across the state of Florida, the more that you social distance, even the medical staff, CDC, the World Health Organization, the White House medical team have all said the same, all those medical people have said the same thing. Social distancing will work. Please please social distance. Those that can stay at home and work from home, please stay at home and work from home. Those that must go to work, make sure that you are not congregating in large groups of people, social distancing in those areas, making sure that there's cleaning, enhanced cleaning services done in those areas. And we've seen a slight change to the curve. So where it was about 3 weeks ago, we were going directly up and just large numbers of new cases all the time. We aren't seeing that as much anymore, so that's good. Unfortunately, we do have a couple things to report that is negative today, and that is we did have our third fatality yesterday morning, very, very early, and our fourth fatality last night. So we have 4 fatalities now here in Seminole County related to COVID-19. The numbers are good, but I gotta say that here in the Emergency Operations Center, those in our intelligence unit. So the way we're split out here is we have a planning section that looks to the future. What do we need in 24 hours? What do we need from 48 hours? And what are we going to need a week out? They're doing a lot of the planning for what this will look like in a week, 2 weeks, things like that. Our logistics section, which is providing personal protective equipment from the state, federal, and private industries to our assisted living facilities, nursing homes, and hospitals. Our public information unit, of course, and you mentioned those folks, and we're pushing out information on all social media platforms. They are working on our press conferences that we've been doing once or twice a week. We try not to do too many of them, but we certainly want to do enough to keep people informed. And then something we started in Dorian was the Facebook Live, and it worked really well in Dorian. So we just continued it, and I hope it's successful. We tend to get a lot of good comments from that. So the public information staff helps us to do all of that. And then we have a really important group here, and all the other groups are very important, but this group is just super important, and that is our intelligence unit. And our intelligence unit has about 9 people in it, and they call all the COVID-19 positive individuals each and every day to check on them. I've had the opportunity to sit with them and talk to some of these patients, and let me tell you, no one wants this virus. This virus makes people very, very sick. I have been on the phone with individuals that can barely say words because they're having such a hard time with their respiratory challenges. So this is not something I wish on anyone, and hopefully we will get through this and no additional new cases. I know that's unlikely. We will continue to get new cases, but hopefully we can keep them low, and certainly hope we can keep the death rate low.
And I think that's one of the scariest things when it's coming into, I know that you were talking about phase 1 during your program, and this trying to carefully get back into business and reopening up our county without harming or causing detriment to the health of others. This has got to be a hard balancing act when you're thinking about when and who's making, how is this going to happen for phase 1, or how far out are we from phase 1?
Sure. So, there's a lot of factors. So let me talk about the statistics, and I'll talk about the phase 1. So people are looking at numbers, and it's just like a hurricane, I think. There's lots of different forecasts out there. There's lots of different forecasts on how bad it will get related to pandemic. So they're looking at a lot of different numbers, and we've heard from individuals, well, there's only 300 people, and we have 450,000 people in the county. So what's the big deal? That's the wrong number to look at. The number that we need to look at is our healthcare system. We need to look and see how many hospital beds we have, and can those hospital beds handle a surge of individuals coming into the hospital system. And if it can't, that doesn't mean just COVID-19 individuals are going to be hurt. That means heart attack patients, stroke patients, patients with cancer, and other types of emergencies won't be able to get the treatment that's necessary. So we're trying to keep that medical surge low, and our healthcare workers with the proper personal protective equipment so that we do not damage our healthcare system. From the best models we've seen in Seminole County, it looks like about 15 to 19 days before we hit our peak. If we continue the social distancing, maybe we'll continue this decreasing trend, and we hope that that's the case. We have heard, and every medical professional has talked about this second wave. So this second wave can be very devastating and damaging, or it can be controlled. And I think that we certainly have the intention of making it controlled. And the way we do that is we open slowly, we open methodically, we open with social distancing policies and procedures to make things safe. I know there is a segment of the population that wants to open it all up, get back to normal. You have huge sporting events and movie theaters and bring everybody together real close. And that is not the way to protect our healthcare system. That is a very bad idea. In Seminole County, we have always wanted businesses to be able to stay open safely. So all of our executive orders that we've issued have been with the thought that we would be able to keep businesses open. Now, one of our social distancing orders, of course, did affect some businesses. It affected hair salons and car dealerships when you do a test drive. There were ways to work around that. And the auto dealers found a great methodologies for doing that. Nail salons, tattoo artists, and massage therapists. So we are looking at, once we start to get to close to phase one, how to keep those businesses, or how to allow those businesses to continue to operate safely. So we will adjust our executive order accordingly.
Thank you. And I'm going to start reading off some of the questions in the chat box. Do you anticipate the executive order going beyond April 30th, or will go to phase one at this date, if not before this date?
So there's a few things that must take place before we get to phase one. And we've met most of those. And there's a website, let me get to it real quick. It's whitehouse.gov/opening America. And it talks about the different things that you have to do. So you have to have a downward trajectory of influenza type illnesses reported for 14 days, a downward trajectory of positive confirmed cases of COVID-19 for 14 days. So we have seen a fluctuation with that. We haven't seen a total downward trend. It's been up quite a few times. It's been down quite a few times. So it's kind of bouncing around right now. Overall, it is slowly going down. So that means that we may be flattening that curve, which is what we wanted to do. And then you also have to meet that hospitals could treat all patients with crisis care, and they have a robust testing program for that. And we're getting there. You also have to have there's some responsibilities that are required to get to phase one. So you have to have ample testing, which we hopefully will have in our county by next week. We're going to open up some test sites, and that's going to provide that ample testing. You have to have, it says it, I'm reading it directly from the website, quick ability to quickly and independently supply sufficient personal protective equipment and critical medical equipment to handle a dramatic surge in need. We're not there. We aren't there. I can tell you there are days that we are praying here that we will get a shipment of personal protective equipment so that we can fulfill nursing home and hospital requests. We have been down to the wire, down to 24 hours and of a facility not having anything. So we aren't at the quickly and independently supplying personal protective equipment. We're better. We certainly are better than we were a week or two ago, but we are not quite there. And then there are other ones like health and protection of high-risk facilities, like assisted living facilities and nursing homes. We're there. Testing or protection of employees and mass transit. We are there. They've enhanced the cleaning services on Lynx and on Sunrail. So that we're there here in Central Florida. The protection of health and safety workers of critical infrastructures. We're there pretty much. I think most of our critical infrastructure are reporting enhanced cleaning services, masks being worn by employees and things like that. And that's like our power, water, those utility providers. And then mitigation efforts, and we're doing that too.
Thank you. And I want to make sure everyone understands, I'm going to read these questions. Alan does have a short amount of time, so at 1:30 we are going to have to let him go. But let us continue on with these questions. How is testing impacting our local curve? Are we overstating or understating reported cases, and thus the shape of our local curve?
So that's a good question. And we have roughly 21 testing sites that are available right now. They are all criteria based, so you have to have a fever, you have to have shortness of breath, you have to have a cough to get a test. So Are we testing everyone? The answer is no, we're not. Will we next week? With these 3 facilities coming online, I believe we will be able to now test anyone that wants to have a test. So we've heard multiple times about asymptomatic people that don't have the 3, the fever, the cough, the shortness of breath, but yet they have COVID-19 and they're walking around our community. So we're hopefully going to provide, or next week we will provide the ample testing necessary to identify that. Well, so what does that mean to our numbers? Our numbers will probably go up next week, but at least we will start to see a real picture of what's going on in our county.
Thank you. And there's been some suggestion that the path to reopen America should be determined on not only a state by state, but county by county basis. Clearly, no plan can be formulated without communications with our neighboring counties, which may not be as in a ready of a position. What steps are being taken for a regional approach to a reintroduction to the community? And when a Seminole County resident ends up going to a hospital in Orange County, does it go into the statistics for Orange County or for that of Seminole County?
So it's wherever the person resides. So if the person resides here in Seminole County and they go over to, for example, Florida Hospital, or sorry, Advent Health Hospital, Orlando, and if the person passes there, then the number, the death would be actually counted here in Seminole County. Even if a person is positive and they go to another hospital, in fact, we've had quite a few of our patients that are veterans go down to the VA hospital and be treated there. So they're still our patient. They're still a patient that's listed here in Seminole County, even though they are being treated in another location. It doesn't really matter where you are. It just matters where you reside.
I do have an interesting question for you. Dealing with all when we read your bio, you dealt with so many crisis situations, hurricanes, floods, etc. Some of us, when we've gone through a hurricane, we're like, you remember that hurricane, the name of that one, it was last year or 2 years ago. Do you remember every single hurricane, what year it happened, every single, the details of it because of your position?
Sure. Charlie, Francis, and Gene, 2004. Charlie was a very, very fast-moving hurricane. Francis sat on us for about 3 or 4 days. We were praying that the thing would move past us. Gene did the loop in the Atlantic and then came in right around the Brevard, Indian River, St. Lucie area, and then up into the Panhandle. So I remember every single one. Tropical Storm Faye, that 2008, that went all over, back and forth around the state of Florida, flooding us for multiple days. Certainly I remember the Trayvon Martin protests and rallies, and the George Zimmerman trial. At that time, we were the longest operating emergency operation center in the state of Florida. We were operating from June the 6th until July 19th, from when the jury was being selected all the way until the case was over, and then a couple days after that just to make sure that the community was back to normal. Now, of course, COVID-19 will be the longest operating emergency operation center of this county ever.
Wow. The next question, regarding widespread testing, is there any reason a person without any symptoms of COVID should be tested? And I know you kind of covered that in the previous question, but it's a valid question, because people do have concerns when they're walking around. They want to make sure, if they do have a small, they're going to see their mom and dad, and they're still social distancing, but they have concerns because maybe their mom and dad are, older and maybe have some health risks. Is this going to happen where people could just get tested if they want to get tested?
We will be there, and we are going to be there next week. Unfortunately, we are not there right now. We are, I guess, in the Central Florida area. The federal government set up a regional test site. It is at the Orange County Convention Center. It's currently at the Orange County Convention Center. The initial requirement was not to allow that because they were only doing a certain amount of tests per day. Now they're up to 750 tests per day. So you can actually go down there and get a test no matter what. You just have to say that you've been in contact with someone with COVID-19, or you're afraid that you were in contact with someone with COVID-19, and you can go through the line. So pretty much anyone can go through the line. So should someone get a test? So I'll tell you a story, and it's a real quick story, and that is a firefighter was interested in getting a test because he was going to go visit granddad for the Easter holiday just this last weekend. Went to go get a test. Wasn't one of our firefighters, was another firefighter in another location, but went and got a test, feeling great, doing fantastic. Just wanted to double check, make sure that he was okay. He went to go get a test, and he came back positive. Can people come back positive and feel well? Yes, they can. And that's why we're enhancing those tests for all first responders, for all healthcare workers, and then, of course, for you and me too. For anyone that wants to go get a test, we want them to be able to get the test, and that's why we're opening up multiple drive-through sites here in the county next week.
Thank you. And will Seminole County make their opening plans with or separate from Orange? As we know, a lot of counties work together in some ways. Is this one of the things that you're working with Orange County in order to work together and make your plans on reopening?
Yeah, so I'm sorry I didn't answer the first part of that question a couple questions ago, and that is, have we been talking regionally? Yes, we have. Will we be different than Orange County and Osceola County? Well, we are. We are currently. There is a curfew right now in Orange and Osceola County. At nighttime, you cannot drive around Orange and Osceola County or risk being pulled over. We have not introduced a curfew in Seminole County, quite frankly, because there hasn't been a need. We have heard from law enforcement officials and firefighters and medics that have been out on the road, and they're like, it's a ghost town out here. There's nowhere to go at night, and there's no one on the road. It's never been like this, so except for like hurricane times. So we have not seen the need for a curfew. So we already are different, and we will be, hopefully. Some of the things we're certainly trying to make as many things the same as possible, but I can tell you if the Orange and Osceola County reintroduce their executive order for the closure of businesses, I don't know that Seminole County is going to follow suit, just like we did last time. We allowed businesses to operate. We just said you need to social distance, and that's why our grocery stores, our hardware stores had markings on the floor before any other county in the state of Florida, because we were requiring it.
Thank you. And I have heard that the decisions relative to emergency orders ultimately are your decision as the chief administrator in consultation with others through the emergency management office. What is the most unnerving decision you have had to make as the chief administrator?
There's an executive policy group, and the executive policy group is made up of the fire chief, the Department of Health senior official, the health official, epidemiologist, a medical doctor, the medical director for the fire and EMS system, the chief law enforcement official, so the sheriff, the chief lawyer, so that would be the county attorney, as well as the county administration staff, so the county manager, and then the chairman of the board of the county commissioners. So we all get together and we all discuss activities, so what we need to do. One of the more challenging ones is I'm a very strong spiritual person, and my church went online very, very early. But to tell other churches that you also need to go online, it's the safe thing, it's the healthy thing to do. But there was some conflict because I know that some churches are small and they wanted to meet, and so we talked about it. We got medical advice. We spoke with the medical doctors and said, what's the safest thing to do? We want to do what's right for our community to prevent the spread. And we've seen now the churches that have opened and full services in other parts of the country, numerous people getting sick, one pastor dying of COVID-19, just very horrific things and news articles coming from churches that did it. So I think we made the right decision, but it was a very challenging decision.
How else can the community support the county?
The best way, I think, is to support our nonprofit organizations. There are a lot of nonprofits that are out there helping people right now, and there's a lot of hurt out in the community, a lot of need out in the community. So working with Rescue Outreach Mission, which is our homeless shelter, is maxed out right now. They need help. Harvest Time International is providing food services. They need help. Sharing Center is providing clothing and food to individuals that are inside their home, stuck in their home. They need help. Meals on Wheels. So there's a lot of nonprofits, whatever your favorite nonprofit is, whatever you affiliate with, there is a great need out in our community. And I know those nonprofits really need the help now more than ever.
Thank you. This is the Chief Administrator, Alan Harris. Thank you so much for your time. I really appreciate it.
Thank you.
I can't tell you how much it is to get an update. If you want to see him, go to the Seminole County Facebook page. You do an update twice a week, correct?
Yes, we do it on Tuesday and Friday at noon, and then immediately following, Walt Griffin, the superintendent of schools, does a Facebook Live on his page from 12:30 to 1.
Great. Thank you so much. Have a wonderful day, everyone.
You too.